Thank you. Now, today's wingworms, the first categories in Wenbing we discussed. Usually people have questions. Should I always to mention the clinic symptoms wingworm before I go through treatment? Not necessary, because we learn in Wenbing, we try to clarify the understanding about the different categories we mentioned theoretically. In the clinic, once you could go through proper differential diagnosis, you don't really need to match the name of this, which category it is, just based on differential diagnosis, you still can go through treatment. So continuing the discussions about etiologist pathogenesis treatment. So here, like this one, they did not mention name of Wenbing at all. They're only using what? Burning of the yin in the nutritive level by heat affecting collaterals. So this is what we need to do, the principle of treatment, based on aligned to the differential diagnosis. So disperse the heat from the nutritive level to the chi level, so from deep level to up level by cooling the blood and supply the yin and clear the heat from the heart. So this is based on diagnosis. Diagnosis is presenting yellow here, and this differential principle treatment. So match and then selecting qing yin tang. We know this formula is mainly used for heat and nutritive level, or both nutritive level and blood level, and usually presented correlated with crimson tongue body and without sufficient tongue coating, or scanty tongue coating, or geographic tongue coating. It's either crimson body or deep red. Pulse usually very rapid, but thin is due to heat go to blood level, nutritive level, and deep and much more severe body fluid injuries. So irritability, delirious is typical conditions affect the heart regarding organs. If they affect nutritive level, blood level, heart is very easy to be affected. All the relative dehydration conditions, fever, hot complaining, worse at night, especially yin and level or structure has been affected about the bodies. They may have skin rashes present at different levels, maculas, the whole patches of skin changing color, or individual separated rashes spreading around the bodies. The energy level and can be very, very tired, lower spirit as well. Usually worse in the afternoon and the night. So severe contagious, 7 categories can give us an idea. Yeah, the assignment is you're choosing one of the 7 categories from Wenbing, selecting corresponding the common clinical symptoms and signs in the Western conditions. Yeah, that's correct, Wendy. And the next pattern is onset of this due to heat in the lung. So principle of treatment, clear and vent the heat out, and by disperse the liver's qi, and also cool the blood and promote expression of skin rashes. Once the skin rashes has not been properly erupted, we cannot use purely cold bitter to suppress, to descend heat down. We have to use some gentle and aromatic cooling one to help the skin eruptions. So skin rashes have to be comes out. Otherwise, like people suffering measles, if skin rashes and cannot be properly and comes to surface and very easy leading to possible pneumonia. That'd be much more severe than the early measles correlated with skin rashes itself. There's a question, what is the risk of using venting herbs when the rashes is already expressed? When the rashes already expressed, overuse venting herbs just to make a heat and can come to the surface much more extreme and cause severe dehydrations. Dehydration is the major thing because it enhances perspiration, so more depletions in body fluid will occur. If they're fully expressed. You will see if they're fully expressed. When the skin rash has been fully expressed, temperatures were diminished, or slightly reduced, or managed well. When temperatures still keep rising, and skin rashes only 1 or 2, and you know the heat has not been comes out yet. So gentle aromatic cooling things always good, like we previously mentioned 2 herbs, Huoxiang and Qinghao, always very good to vent the heat out to the superficial levels. Okay, good. You all had similar questions. So chickenpox, measles, they could have similar fevers and chills or no chills, possible cough and chest pain. If there's no more skin rashes, like kids went to the kindergarten, quite a few of them had chickenpox. When you bring the kids out, they had very, very hot faces, but no skin just yet. But it's good to help them get good perspiration if they have not had sweating yet. So maybe through the sweating, some skin rashes comes out. Maybe just help manage the temperatures without any skin rashes, still fine. That means pathogen has been out through sweating. Next question, does this slide means that rashes can come out in chi level as well as, okay, the rashes, people could have skin rashes, even heat go to nutritive level, yes. Because that means you have both or you have more than one levels has been affected by heat. So Wei level, Qi level, nutritive level can be affected simultaneously at once. And not very common when the blood has been involved, they still have skin rashes. Usually they have bleeding instead of skin rashes. Yeah, this answers your question. Yin Qiao San, it's good formula, not just deal with wind heat in Wei level. Actually, Yin Qiao San itself, due to its compositions, they can deal with heat in both Wei and Qi level. But with additional modification, 加减 mean modifications. So Yin Qiao San original ingredients and added additional 牡丹皮、生地牡丹皮、玄参、大青叶 will clear the heat from nutritive level and blood level. So there's a question is, you cannot hear. I'm still not clear. So what's your question, Lucy? Possibly. Okay, rashes is mainly response with the pathogens in the Wei and Qi level. But heat does not waiting for the rashes comes out without further transmission. Heat and unresolved heat in Wei and Qi level can further transmit into nutritive level. So that means if the heat and presenting rashes at the same time shows crimson tongue body, that means you have heat in Wei, Qi, and nutritive level simultaneously. Thank you. So this is a typical formula, 加减银桥散, can resolve the heat from Wei, Qi, and Yin level at the same time. Because you can see they have a 警戒, they have 警戒 here, have a 金银花, 年桥, 波河, the weak conditions, have a 警戒年桥, and the 牛膀子 deal with heat in the Qi level, have a 生地黄, 玄参, 牡丹皮 deal with heat in nutritive level, in blood level, have 大青叶 deal with heat in Qi level and nutritive level or blood level. So basically this typical formula modified of Yin Qiao San can deal with heat in Wei, Qi, nutritive, even blood level simultaneously. But rashes itself indicate the heat in both Wei and Qi level. But the tongue coating, if they become geographic tongue coating or dark red tongue coat, that tells you partially heat also involved in the nutritive level. If any bleeding comes out, so blood level also involved. There are questions. Does rashes can presented in between spring worms and wind worms? Yes. In spring worms and wind worms, you could have rashes, different rashes. Rashes usually correlate with wind worms is not very severe compared with springs. Thank you. Now, next is talking about specific principal treatment, vent of the pericardiums or veiling of the pericardium by transmission of heat with flame. So in the upper gel and stages there, heat from the lung or from Wei or from Qi level and involved in pericardiums and affect the mental clarity. So we're using clear the heat from pericardiums and resolve obstruction of flame in the orifice cause of mental disorders, difficult focusing, thinking, or emotional, spiritual changes. Angong Liu Huang Wan is a classic formula will be involved. I leave you to reading it yourself because I will never ever have a chance using this formula clinically. They'll end up into the emergency ambulance and transportations. But if it happened at home, acupuncture, 人中, and all the 10 fingers, 10 toes do bloodletting. Ear apex do bloodletting, at the same time call ambulance and practice first aid skills. Do not waiting for brewing herbs. Very easy, can leave it behind, life diminished. You will feel guilty for the rest of life. Now here is a basic formula, looks like advertisement, and also compositions. I'll leave you to do reading yourself. This is traditionally a very useful formula. Nowadays, not much of chances for people using that, even in China. They all ended up in the ambulance and in the emergency, or maybe passed away without a chance to have any treatment. I may mention one of the example in different subject. And one man has suffered horrible attack in the airplane. So airplane traveling midway. So there's no way for them to landing nearby any airport. Luckily, his daughter had a bit idea about acupuncture points or something, and he did not know very clearly about detailed TCM theories, because she knows one thing is bloodletting is a very good method to save life for emergency situations. So at that moment, her father is become partially unconscious. So suddenly becomes sleeping down from the chair, and he's sitting in the airplane, and he's suffering hypertension, have cardiovascular conditions. They take the international airplane doing international traveling. So what they saved the life is she asked any of the passengers in their cabin, any of them have any sharp material or any needle things. Luckily, somebody carry on something with their earpins, which can puncture through the body. And with lipid alcohol swab, she cleaned that kind of sharp needles and then massage from the elbow towards the tip of the fingers, because her father's hands feels like freezing cold, like dead person's, no paler. So she did massage and massage all the blood, and then squeezing it, did all these bloodlettings on the fingers, all the 10 fingers. Very, very hard. Each of the fingers only get very, very little drop of very, very dark blood. Eventually, her father waked up from this kind of bloodletting and saved the time for them. They landed at nearby airport, and her father has been saved from stroke suffering. So there's a blood clot happening in the brain. And in the interview of the TV sessions, her father functioning, movement, all like normal people. And the doctor eventually believed the actions performed by the daughter saved his life. Otherwise, we can imagine what is happening. Okay, all right. So do self-study for Angong Liu Huang Wan. Same for self-study for the Zixue Dan. They all use for very critical conditions. Usually is on the verge for expired life. Usually we call it very easy, goes to other end of the world. This is related more flame heat dominated one. These traditional pills are not easy to able to be constructed by our individual person, and there's ratio, special preparations, or secret, or controlled by specific method. You still can purchase these kind of pills in China, in Hong Kong, in some Asian Southeast countries. Some of these pills containing forbidden ingredients, banned ingredients in Australia. So maybe you cannot get it here. Maybe you can get it in mainland, in Hong Kong, in Southeast Asian countries. So if you travel in Asian country, and your companions or your people in the team have some similar condition, maybe could happen during the path of traveling, you can keep that for emergency use as a first aid. And they are legal in Southeastern country to sell that one. But here, if some composition is banned, it's not legal, but they still could. You find the products, but I'm not encouraged that to say that. Okay, you find it yourself. Now, next, talking about blockage of the heart by transmission of heat coupling of a dry stool and heat in the large intestine. So when you see this dry stool, you know, resolve the dry stool is very essential to resolve any kind of heat related to the mind, to the heart, isn't it? So open the bowel, rigging the bowel mode is very essential. And this is still talking about very, very complicated and serious formula. This formula, if you can get it, usually traditionally is a wax sealed, so they can keep for many, many years without have any trouble of the expired products. You can, and then for emergency, you just need to crack the wax and then to consume it properly based on instructions. Using this formula together with Da Huang helped open the bowel to help withdraw the heat from the large intestine. So very, very important one. So nowadays, this principle basically, no matter your clarity, your mental clarity is affected by the bowel movement and by high temperatures. Once this shows dry stool or constipation, if you can help the bowel move more regularly daily, and your mind focusing will be much better result. Now, next is more combination of everything. 止血丹、治保丹、安宫硫磺丸, they are very, very valuable, very useful formula traditionally. We do not have a hospital, we do not have emergency, we don't have ambulance can help. So how you're going to save people from this kind of critical condition? These 3 specific patent pills are very, very valuable in olden days. 3 of them used for excessive type conditions. So you can imagine heat, internal excessive heat obstructions, and excessive conditions with collapse symptoms. So basically, you call ambulance. At the same time, manage some acupuncture point stimulations, and then you deal with it. So by reading the composition, clinical application yourself for this specific formula, you can understand why you don't have a chance to practice here locally. Now, the summary for the wingworms. Here also partially mentioned about what levels of bodies will be affected, progressions, and what the durations or seasons they are affected. So wingworms usually affected by the wingworm pathogen. That's why called wingworms in Wenbing. The mainly affected part of the body is the lung systems or defensive levels. So we call it also correlated with Sanghan. Correlated with Sanghan is Taiyang divisions. And most of common organ channel involve lung channel, lung organ, and the diaphragm, pericardium organs, or in pericardium upper GI. But in the middle stages, they can affect it. This relevant mentioned here, Yangming, lung organ, diaphragm. But more in the early stage, for severe transmissions, they can affect the PC, pericardium as well. But not very common, but still possibly occasion could happening. And later stage, they can result very serious indeficiency, mainly in up and middle GI, lung and stomach. So they do not affect the lower GI as common as other patterns. But occasionally, if you already have pre-existing liver and kidney deficiency, you may show some further depletions after wingworms attack. So that's not a common condition. These are most common conditions. So when you're choosing the conditions regarding the clinical presentations, they're very mild, like Sang Ju Yin or early Yin Qiao San stage of conditions. In the early stage, and the Bai Hu Tang, Chen Qi Tang middle stage, and Sa Shen Mai Men Dong Tang in the later stage conditions, and they put in the category of winged heat worms in Wenbing. Winged heat worms mainly happen in the spring or winter. They could also happen all year around in the very windy seasons. And most of progressions is normal, slow progression from early stage to later like this, but they could have some exceptions. So these are common progressions like this arrow, but they could jumping. You could jumping combine both, and could skipping and one and go to another stages there. Can yin qiao san causing sweating? Yin qiao san is one of the formula we discussed in the diaphoretic category in the formula. Yes, yin qiao san should help induce mild perspiration when you're taking smaller doses of powder with hot water. Yes, but because yin qiao san have lots of bitter cold herbs inside, yin qiao san also can deal with both Wei and qi level conditions there. So that means if people have very severe sweating, profuse sweating, usually you do not using yin qiao san as a first choice. Instead, for big four conditions, big sweating, big fever, big thirst, pounding pulse, we're using bai hu tang. But once you have both Wei and qi level simultaneously, you can using yin qiao san. Thank you for the question. And I think that's all done for today's required information in the blackboard. Now it's question time. Any questions, guys? Looks like we have not allowed to have enough time to can, okay, I'll just check questions. Can I ask questions about AC? Yes, welcome, shoot. Yes, Lucy, what's your question? Can I hear, the question is, can I hear last week? Did I hear last week that we have permission to complete it as a literature review, or should it just be pure essay form? Okay, now this question has been asked, I've been answered a few times through my class message reply. It's good this question comes out in a group. Now, due to insufficient English version of research and relevant Wenbing article, so go through literature reviews, you may do not have sufficient what? Reference resources. So do whatever you could to manage complete this assignment. That's all. You can do that as an essay form. You can do that as a literature review form. Once that can help you understand one of the categories within the Wenbing you're choosing, and also relevant disease you selected, and prove the understanding, and that's a major task we want to achieve. Good. Anybody else had the question regarding to assignment? There's plenty of Chinese version of articles online, but it's hard for non-Chinese reading people. And Chinese, so it can be challenge one. Any more questions for the assignment? Okay, not for the assignment, but the exam. Is it going to be online, or I just can't see it? Is that for the, I don't know yet, because you can see the, okay, if Nicole says online, it's online. Okay. Thank you. Okay, thank you. Okay, now, if you don't have any question, let's have a look. Anything else we missed from the revision or exercise? So this we have been discussed about the concept, features, progression, Wenbing worms we discussed. Etiologies, pathogenesis of windworms, differentiations between windworms and springworms very briefly. Treatment principle, cautions of windworms, common patterns, formula we discussed in windworms. And here, let's have a look at the rest. Okay, I believe everybody has a chance to read all of that, haven't you? So this is a written example of the windworms case study. So female, 4 years old, had admitted to the hospital at March. So this happened in China. So March is still spring in China. Reported by her mother. The child has had fever, cough for 3 days, and accompanied with wheezing for a day. So this typical what pathology? Lung pathologies. If it's organ, yes, the lung pathology. If it happened in spring, because in China we know possibly so quick, maybe it's a kind of windworms or springworms. A fever lasted for 3 days. At the beginning, she was slightly hot, cough, and congestion in her nose, diagnosed as upper respiratory infections locally, and had been taking Western medication with no improvement up to the 3rd day. So after that, fever has been worsening, reached to 39, and cough became more severe with wheezing and shortened breathing. Flame was sticky and difficult to clean out. Lots of sweating, thirsty, wants to drink liquid, unable to sleep at night, vomiting 3 times, which contains food, bowel movement 3 times daily, with loose yellow stool. So it looks like it have heat or have a damp. Short and dark urinations. So what's the impression? Tongue is red tips, slightly yellow with dry tongue coating, and slippery and rapid. Because we're talking about wingworms, yes? We know definitely it's not damp worms dominated, even they have loose stool. We know this is not spring worms at the beginning. So one 麻杏石干 has been recommended. Let's have a look here. The answer is external pathogen has entered the chi level with exuberant heat in both the lung and the stomachs, and a damp heat retention in the intestine. Because children, how old? 4 years old. So within the 3 years old, usually they don't have a strong spleen chi. But if constitution is not strong enough, even 4 years old age, the kids still do not have very strong constitutions, and they can be developed or consolidated up to the puberty ages. So they have some level of damp heat, but the heat in the chi level is more dominated. So why there's reason? The illness happened in the spring and initiated symptoms caused by external pathogen attacking lung and wing symptoms, which is correspond to the first feature of the wingworms. The 3rd day, unresolved pathogen entered in the chi level, presented as kind of affected both lung and stomachs, causing lung unable to disperse descending, and heat pathogens condense body fluid into flame and injured stomach yin, present as a fever, cough, wheezing, stick sputum, difficult to expect, lots of sweating, thirsty, and wanted to drink water. Then I sent it on Sunday or Saturday, Mark, Charlie. When exuberant heat in the lung and stomach disturbed the heart spirit, the patient could not to sleep. The heat affected chi dynamic in the stomach, resulting in vomiting. Both lung and the large intestine have exterior and interior relationships, so couplings. So lung heat can affect the large intestine, resulting in diarrhea if they have damp correlated. Short and dark urinations, all of that indicated heat in the chi levels. So that. So based on the previous analysis, you can clear the heat from both lung and stomachs, and also need help manage the heat resolving from large intestine at the same time to resolve the flame and easing cough and wheezing. Not in the zip file. Yes, in the zip file. I sent a zip file on Saturday or Sunday. Yes, in the whole zip file. From this week, all the remaining additional exercise information in the zip file. Thank you, Bridget. I forgot the zip already. All right, formula modified. 白虎汤、麻杏石甘汤 and 葛根黄芩黄连汤. Why they did not choosing single formula? Why they using modified formula? That's my question. If we only using 麻黄汤,白虎汤, they do not have ability to manage the wheezing and the cough. Yes. If we only use 麻杏石甘汤, they do not have ability to deal with constipation, diarrhea, loose stool. If we're only using 葛根芩连汤, they do not have ability to deal with cough-related concern. So that's why using modified these 3. So this is the original formula using 石膏、知母、麻黄, etc. All listed here. Dosage is quite high. Why they using this dosage? Because temperature is over 39. If you don't use large dosage, and the heat cannot be resolved, you need a specific heat management medication to resolve. Solubility of sugar is low. So this is brewing, these decoctions. So 2 packs per day, one in the morning and another in the afternoon, taking 0.6 of whole zao as an additional one to manage the toxic heat. So what is a whole zao, Sam? It's a very good one to manage the heat and the sputum and the flame. And this is, I don't think you can get this one here in Australia due to Niu Huang and other ingredients, whole zao. They are not animal safety. They are not animal friendly herbs, but overall this formula we need understanding is try to manage, can deal with everything. So what result they achieved? They clean up temperatures, for the kids very well, and they very control the cough related conditions, and also virus cause of loose stool very well managed. Now this happened in China, but here maybe we are not brave enough using such large doses for 4 years child. So here just example from other people's very good experiences, practice in Wenbing. And this is what we need to do in the private time. So all the answers already provided in the bracket and just put into the space. So I'll leave it for self-study. And here is, we need to mention the list of worms correspond to the modern disease regarding to similar clinical manifestations, such as regarding to common conditions of the wingworms related acute respiratory infection illness, so viral or bacterial related pneumonia, influenza, acute bronchitis, upper respiratory tract infections at early stage of meningococcal conditions. So it's up to you to choose proper clinical symptoms and signs. And this is very simple exercise. Okay, just have a look if we can match it. If we can match it, that means you're able to review the pathology diagnosis we learned in 2nd year. Just a very quick volunteer, have a look. I will leave the rest for you. Damaged body fluid, disturb the function of Wei Qi, and the dysfunction of the lung. Thank you very much. So we're all understanding what that means in TCM. So this is interpretation of TCM. So all this theory we learned, you're going to learn in the 4 years of training, is to be able to understand it. But for ordinary people, they know this with disease, name of disease, that's it. So as a kind of the training, first part, pathology, very important. Now, this is a similar flow chart, which I put it as additional information. So is any question for this slide at all? Oh, this is original slides in the main files. So it's similar. I have a look at this one. Comparison between wingworms and springworms. Quick match. Wonderful. So noticeable, that means exterior symptoms will last for a few days before they go to further other levels. But for these are for wingworms. But for the springworms, they have more short. Sometimes you have not aware they have exterior, the wing levels disorder. They already become very severe, exuberant high temperatures. So here's the progression of patterns. There's a question. Before you were saying that both of these categories may be treated in a similar if they're all in the V level. Yes, if they're all in the V level, you catch it, you treat it similar. And if they're all in the Qi level, you catch it. That means already go to Qi level. You don't need different name. Normal progression is slowly from one step, follow each step like you're walking on top of stairs instead of go to lift, yes? The reversing progression is like you're taking lift from ground floor, go to 5th floor straight away. So they're very quick and very strong pathogens and poor constitutions. time of the year illness, main symptom signs associated, correct comprehensive diagnosis skills. So what is important for diagnosis of wingworms? So times of the year, spring and winter, many symptoms and signs associated with what? Upper respiratory conditions, typical V level as early stage, slowly progressions, correct comprehensive diagnosis skills. What is correct comprehensive diagnosis skills? Tongue pulse, and symptoms asking. So inquiry, palpations, and observation will be very useful. And this is very important to understanding Wenbing, especially wingworms treatment. Specific concern we need to take in. So just march left to the right column. Early stage and later stage, or in between. Nobody wants to draw the line. Very simple one. Thank you. So early stage, pungent cool to clear heat, expel. Vent, yes. Later stage, and clear the heat, sweet. Middle stage, like this. So checking the red one is correct. So there's some little bit misunderstanding. Later stage, we will apply sweet and cooling herbs, general body fluid at the same time to resolve remaining heat. Thank you. All right. How about try if we can match from left to right with the basic pattern and the common formulas used clinically. 银桥散、桑菊饮、麻杏湿干汤、栀子池汤 and 小蟹胸加子池汤。Okay, definitely this flame damp heat 呢，小蟹胸汤加子时，小蟹胸加子时汤 yes. And heat from constraint in the chest, the diaphragm, causing congestions. You can use 栀子池汤. And pathogenic heat congest lung and stomachs. You can use 麻杏湿干汤 if cough wheezing is so dominated one. And early stage lung has been affected. 桑菊饮 usually is quite commonly happening one. Or 桑菊饮 from mild cough from A and B. But if the sore throat is that major, definitely 银桥散. So A and B is very easy confused because they did not mention any kind of clinical symptoms. But based on at early superficial V, so usually using 桑菊饮 start with. So this should be using that one. But if you mention the lung affected by wing heat, so both of this one and the two formula should all can be applied. Unless I mention sore throat, 银桥散 will be appropriate one. And clinically, if this sore throat goes together with constipation, presented heat, congestion, lung, and stomach organ, you can also using 银桥散. So you can see clinically it's more flexible than theoretical trainings from the patterns. Any question for this slide? It's a bit messy, isn't it? All right. This one we mentioned already, and additional slides. Here's a comparison. We had that in the previous slides we mentioned. So, all right, have a try this one. Match the following simple pattern on the left with the right side of formulas. Remnant, so residue of the heat with injury to the lung and the stomach yin. Blockage of lung by flame heat, coupling with clumps of stool and heat in large intestine. Transmission of heat from the lung to the large intestines. heat from excessive in the stomachs, injury the body fluid, and clumps of dry stool with heat in the large intestines. So once you have a flame heat in the lung with constipation, 宣白承稀汤 is excellent. And that means residue of the heat with indeficiency, 沙参麦浓 excellent. Transmit the large intestines, this is wonderful. And excessive heat and some injured body fluid, good, excellent. So this we have a lot of agreement to each other. Thank you very much. Very good team. We had this discussed already. We had this discussed from previous in the class. That's why I did not send it for you, because in additional revision slides. All right, quick one, have a go. About diagnosis, principal treatment, and selecting formula. Because all the answers here about formula already put in the bracket. If these simple conditions present in for the clinic or for the exam, you should get instant result very quickly. 银桥散 because of sore throat. Very good point. So definitely this is the correct one. Windworms at wheel level, excellent diagnosis. So this is wheel level attacked by wind heat. Wind heat attacked wheel level, or wind heat attacked lung systems. So treatment disperse wind heat, and from enhanced perspirations, the formula 银桥散 is good. Now, if this one also have a skin rashes, you can use 麻黄连桥赤小豆汤. So because it's don't have skis, so 银桥散 is good regarding to sore throat. Now, this is the second one, even more simpler. Cough, fever, slight thirst, aversion to cold, floating, and Looks like the formula you want to select is not in the range, isn't it? Still 银桥散 again, or other one you should say 桑菊银. So clinically, you can see this is more complicated in a way, and more typical 银桥散, we can thinking about it. But for this one, and we are thinking about 桑菊 instead, yes. But for some people, even they have no skin rashes, because the fever is much more than a chill, they have aversion cold and a cough, with sweating, thirsty, sore throat, they could even, without using 银桥散, still can using 麻黄连桥赤小豆汤 due to cough, together with sore throat. It really depends on clinical experience. So this formula you should learn in which classics? Classics 1, yes. So they all can be accepted clinically. So here, without option of 桑菊银, you can choose 银桥散. And this is not too strong, no wheezing, no cough. This one, no agitations. So looks like 银桥散 will be good for these conditions then. How about this? This is we learned a long time ago. So it's not a typical big four with additional wheezing and a cough. 马杏石甘汤. 小青龙汤 is for cold types condition, but this one is what? Is heat types conditions with yellow sputum. 小青龙汤 for slow pulses or weak pulse with clear sputum, white sputum. So this is very important we know this condition is yang condition. 小晴龙堂 used for yin conditions with deficiency internally as well. So this using 麻杏石甘汤. Thank you. Now next slide is fever, vexation, irritability, restlessness, insomnia. So heart, emotion, good has been affected. 栀子池塘 is the most simple one. So using gardenia seeds and 豆豉 to help clear heat from both urination and bowel movement. Wonderful. And how about this one? Flushes face, fever, thirst for cold drinks, vomiting after drinking, so too much heat internally, reject the cold drinks, chest and epigastric distension, distress, pain and pressure, so excessive obstruction like glomus, and also his constipations, and hot, and top and thirsty. 小陷胸加紫石汤. Yes, this is a very good one to manage glomus-like conditions, congestion in the chest and up middle digestive regions, as well as constipations. Wonderful. Okay, next one. Cough with yellow sputum, dry stool, fever, thirsty, abdominal distension due to heat affect the large intestine, cause accumulation. So cough and dry stool comes together with a flame. What are you doing? Using 宣白承气汤. Wonderful. Because they have, besides of 承气汤 inside, they also have 承气汤's ideas inside. They also have ingredients without the flame and descending lung qi. Fever, dry mouth, dry cough, sticky sputum, hard to get out. So they have fever, have dehydrations, have rebellion lung qis, and more what? More looks like dehydrated. Yes. 沙参麦门冬汤. Thank you. Because all the severe disease were only treated up to 60%, and non-severe disease we treated up to 60%. All the remaining part either using more simple, gentler formula or apply diet therapy. So this is a good one. Now next, very bad smells, odor from the stools, still high temperatures, and also have very bad possible cough and red, yellow coat, red tongue body, yellow tongue coat, 葛根黄芩黄连汤. Thank you very much. So damp, heat, correlated. How about this one? So this basically is a very simple exercise for the pathology and diagnosis, and also review formula we learned today. The exact same clinical manifestation presented in previous slides. So big four, this is typical big four with part of body fluid and a chi injury. Thank you. Now, next one, constipation, abdominal distension, pain, and foul smells of watery stool, and deep fossal pulse, red, yellow, dry tongue coating. Okay, what does this mean? Is that excessive or deficiency? It's excessive. That means still have typical excessive heat inside using 大承气汤. 调味承气汤 more for deficiency involved. So 调味承气汤 is not proper one. Okay, here 大承气汤 is correct one. Still excessive heat, excessive qi obstructions. This fourth smell is blockage of intestines. Remember when we did formula study, imagine this a tube of intestines. I know it's not intestine, not like this. That'd be horrible, sick. Part of the lesion from infections in the lining of the dysentery result in horrible inflammations. Yes, they keep growing, inflamed, accumulate lots of poo and inflamed tissues, and also very bad discharges there. When the poos try to pass it through, partially poo got blocked some way due to blockage here. and partially going through as kind of water. So if blockage very severe from the dysentery related inflammations or swollen up, only liquid can be passing through and carry on with very bad discharge smells. So this still called that excessive obstruction, have to be breakthrough through using 大承气汤. Does it help understanding? Thank you. Now next, irritability, delirious, dried mouth, and does not want to drink, fever, worse at night. So if once this presented, tells us what? Together with this, so structure of the body possibly can be affected, especially when the tongue become deep red, scanty. So it's much more severe level of heat cause of damage of the organs. Usually they're using something 清yin tongue is nutritively yin and blood heat dominated. But if it have wei, qi, and yin all involved, using 加减银桥散. Okay, which level has been involved and more dominated in the qing yin tongue conditions? Yes, thank you. Again, this is chickenpox suffering or measles. People also have fever, no chills, possible cough, chest distensions, red tongue body, yellow tongue coating. Okay, any level conditions here at all? So it looks like majority of them go to qi level, and this in order to help skin eruptions, because all internal already, did not mention any skin eruptions. So we're using 加减银桥散 here to help unresolved rashes comes out, also clear the heat which is already affected qi levels internally. Now, fever, cold limbs, loss of consciousness, deep speech with stiffness of the tongue, deep, thin, rapid pulses, and deep red tongue color, scanty coating. 安宫硫磺丸 is a more severe condition due to excessive heat, damage the yin. I hope I'll never have a chance to see this in our own practice. Very scary. Now, once people lost the consciousness in your practice, you become easy to get a panic attack. And this one, still similar, emotion, constipation, also have constipations. We need to use and Gong Liu Huang Wan again. Or they don't have flame. The flame dominant using Zixue dance. Either of these one you can choose to save the life. So what we can do in the clinic is the most important: do bloodletting or do point stimulations. Either 人中 point stimulation, ear apex bloodletting, and 10 fingertips or 10 fingertips is easier than the toe tips. So do fingertips bloodletting to maintain good consciousness at the same time call ambulance. Okay, we'll leave that. This one, coma. I don't think I'll ever have a chance to have a chance to see that. Okay, but this summary already goes through summarized from previous hours. So let's have a look. What's remaining for the day? Now, any questions? Is that a bit rush? Or are we still okay? Now, they still have a few minutes left, like we always did in the past. We are going to have a look at the tongue again. You may already heard naturopathy, nutritional medicine, and homeopaths. They're going to practice telepractice clinically for their students. So that means maybe if this kind of epidemic illness happen like this one day, or as you choose, you're going to choosing telepractice as well. So for telepractice, you're going to able to utilize a lot of observation skills such as checking the tongue, color, and tongue coating. We discussed this one already. Okay, how about this one? Any of your children, they like to eat different color icy pot, some very nice lolly, yes. When they stick their tongue out, oh my God, like blue tongue lizard, yes. So second tongue coating is typical tongue coating has been died from different diet. So it's not from illness, from the diet. If this happens, you can ask them what they've been drinking or eating either same day or previous night. But overall second tongue body does not belong to Wenbing, that usually not correlate with Wenbing's tongue body or tongue coating. Okay, which image, first and third one, is more commonly present in Wenbing and why? 3. Okay, number 3 still have noticeable redness around the tip and the edge, even frontal, and very, very nasty and unevenly distributed, very dry, greasy tongue coating from middle towards the back, gray like a coffee, and also some yellowish distributed as well. But the first one is more purple red, had very bad patch missing and rear part or lower gel part of the tongue coating. So both number 1, number 3rd image could represent Wenbing in different stage. So for number 1, tongue image could represent it in damp heat worms, Wenbing, and with ink deficiency in later stage. They still have unresolved damp heat. That's why tongue coating still yellow, greasing all over. You can see that one. Yes, all over yellow, greasy tongue coating, but already have with exist ink damage in the lower gel. So this kind of body coating matches missing. Usually you can encourage people eat more vitamin B rich food. They can help recovering this one to restore the proper presentation of the tongue coating. But with surrounding body of the tongue here is a more purplish, purple red, yes? Because the tongue has been overstretched, it's very hard to see proper shape. But with this kind of overstretch, can you see slightly both of the side of the tongue? I just check select proper color. And getting much more swollen up, both sides, yes? This could happen when we ask people stretch the tongue out fully, and they will usually show that much more noticeable bulging, more emotional congestion they have, much more noticeable bulging or raised up on the side of the tongue. Here just tells you. Really red gum. This is not gum. These are some inflammation related heat. Here is a gum. Gum is a pink. It's okay. Here is okay. Little bit red, not too bad. But here is a very red inside. Still have some inflammations involved. Little tissues there. Yes, Olivia.
Ying-Mei, you often use the word emotional heat. Does it always have to be emotionally based, or can you just have heat, you know, in the liver or gallbladder area?
Yeah. When people have unresolved emotion, you can have emotional qi obstructions. With long-term unresolved emotional qi constraint, the qi is very easy to turn to the heat. That's why some people never ever shows much of a breakout of emotions. Always follow, listen, follow also opinion. One day suddenly somehow triggered out, quarreled with their boss or with other parties. This is typical, we call that congestion heat, suddenly like a volcano and break this through. Does that help you understanding?
So it's always emotional based. Always.
With this location of the raised, the tongue correlated to what organ?
The liver and gallbladder.
Yes, that's why it's always related with emotional.
Okay.
Can we see a lot of red dots also evenly distributed on the bodies as well? Through see the thick greasy tongue coat, can you see these patched little bit red dots? There's a lot of emotional involved.
Okay, yep.
Now, okay, we go through this one.
All right. Thank you.
Any of you can see the noticeable red dots around the tip and edge of the tongue? If the mainly present the tip and edge like this, image 3, they relate with congestion heat. This congestion is all emotional dominant. Why? Because correlated of region of the heart and the liver, wood element and fire element. That's why all emotional involved. But if this kind of heat only represented in the regions such as middle gel, if it is very, very hot, not necessarily have emotions at all, but they could have middle gel and upper gel lung, upper gel lung and middle gel heat due to some external invasion due to unresolved heat. Does that answer your question, Olivia?
It clarifies things. I think I was thinking along these lines in May. I think I was thinking maybe if you have an infection in the liver of some sort, why would that have to be emotionally based? That was my line of thinking, but I take your word for it.
That's a very good point. If we have infection in the liver and people will show very, very poor mood, they can affect the basic qi dynamics. Because in TCM, we do not go through infections. Instead, we say all the illness affect qi dynamics. The qi dynamic in the body could be governed and dominantly control the flow by liver. Any kind of external illness will affect our emotion. Any kind of imbalance emotion will result in clinical imbalance of illness. So there is a question. Could too much alcohol causing this redness in the gallbladder liver areas? Yeah, long-term overconsumption, and this could be typical presented like image 1. So image 1 looks like they have this person, based on the tongue presentation, have a very poor function of liver organs due to this bulging and raised up of the areas on the side of the tongue. Yes, with greasy yellow tongue coating is a possible result of long-term drinking alcohol, improper diet, or maybe result from external and damp heat attack as a wound. And another size, many people commonly have a smaller benign cyst on the liver. Does this have a base in emotional stagnation? Now, benign cysts you only can find out from the scan, and they cannot always correlated with the CM differential diagnosis if they have no clinical symptoms presented. If we do have clinical symptoms presented, related to easily stress and easily to be affected with emotional issues there, they are much more commonly to incline have abnormal functional changes over time in the liver organs, especially if they have emotional constraint with damp constitution and much more prone to have possible cysts growing in the bodies. Like people present a tongue coating as the first image presented, people like this, if it's long-term, ongoing, chronic tongue coating like this, they do not have a healthy digestion system. Yes, that means they're very easy to have possible damp and the flame generate inside. So where does the flame and the damp stays? Either asthmatic cough, abnormal growth as tumor, or cysts, or body weight gain, and as a kind of adipose tissues or fat, or enlarged lymph nodules or glands. Yes, Livia?
No, Ying Mei, I haven't put my hand up. Sorry, I don't know what's going on.
Okay. All right. Now, any questions for these 3 images? And second one, you can see noticeable teeth marks. These are pink paler. Coating is uneven. Yes, they all have uneven coating. So 3 of these images, they all have uneven coating. So based on our understanding, tongue coating represented for the stomach's qi. If you do not have a balanced stomach's qi, usually you do not have a balanced liver wood. Livia, you raised your hands again. Okay, thank you.
Sorry.
Incidentally, it's all right. So that means they answered and also tells us a clue. And uneven or liver qi stagnation is quite a common conditions in our life, but they're not always causing clinical suffering if we're able to manage it and regularly. And second part, you can see and different level of colors, the thickness of tongue coating correspond to different locations of bodies. So lower gel, middle gel have much more thick, greasy tongue coating, which indicated even the second slice, they are not normal color of tongue coating, but still with much more concentrated color, as a blue in the middle tells you original greasy tongue coating in the middle is much more dominant. So 3 of these images indicated they do not have high healthy TT function in the spleen. And middle image also shows teeth marks, further evidence tells the spleen's Qi deficiency. With reasonable pink paler tongue body, middle image tells us have what deficiency as well? Blood deficiency, have possible blood deficiency. And can you see noticeable old strawberry from here? So vampire has sucked off all the blood for this second tongue image, left behind image of strawberry, yes? So this is a latent pathogen. This is not current one, latent pathogens or unresolved emotions. So here just let you know something still blocked in the collateral. And this one's blocked still a bit fresh for third image. You can see patches mixed of red and white color. So some dehydration is involved, even they are not typically cracked. But you still can see central lines from number 3rd image, yes? So some damage from the body or heart lines. Compared with these 3 tongue body, we're assuming they're all in the normal size or normal, did not enlarge, did not change the basic passage. Which one is the most narrow one for you to compare? Number 3rd one is more narrow. Thank you. Now, has any of you realized, first one, due to overstretch, they become so like little drum, so big from the outward of part of tongue body compared with the remaining of the tongue body inside. Have you seen these differences here? If this kind of drum-like shape of the tongue presented for people above the prime age, and do be careful about their heart. The structure of the heart may have some level of obstructions due to purple tongue bodies they presented. Because this tells you up and middle jaw has been extremely enlarged and due to reasonable weak qi, because we learned before, swollen and flappy tongue have inclination to what? To qi deficiency or indeficiency. Above the prime age, above the middle age. Good. So swollen and flappy tongue have inclination to qi deficiency. That's why I mentioned here, if you see people when they stretch the tongue out, looks a little drum. So much more enlarged for the out part of the structure compared to the remaining part, and they may have possible qi deficiency, especially correspond with their heart. For the second tongue, so relatively, the tip of the tongue is smaller, yes? Same as the 3rd one. So this part relatively smaller as well as this one, okay. So they have some anxious heat, also represent on the dots presented on their bodies there. And both first and second image show some swollen around the edge of their tongue. But for the number 3rd, the swollen around the edge of tongue here shows insufficient nourishment for the blood. So a bit pink pale, watery. They don't have enough blood there. So that may be correlated with smaller tongue as well and deep cracks in the middle. Okay, and any question for these 3 slides? Okay, all right. Just very quick have a look this one, and then we're going to finish. So first one and the 3rd one, both of these first and 3rd one, you can see a lot of strawberry-like dots, isn't it? Which one looks more fresh? Fresh picked strawberry. Which one is fresh picked strawberry? Right hand, number third one. Okay, so that means this one has more current heat. Yes, this one has more current heat and also weak spleens. Weak spleen in the middle because the tongue coating is white greasy, but lots of heat and happening at the moment. And a bit and tilt to one side. Maybe it's a child that they don't know how to stretch the teeth out. And first one's also child. So this one tells you have residue of the heat. So some latent pathogens from the previous heat suffering. So many remaining dots shows old, not fresh, or has not been properly matured strawberry. And still show the weakness in the spleen regarding to very gentle distribution tongue coating here. How about the one in the middle? Is it still severe heat stage or later stage after suffering Wenbing? Does the tongue show the bright red or has been shows the later stage of heat or early stage or middle stage? Number second one, later stage. So this is not bright red. This shows in later stage of a tongue. So it shows the structure body has been damaged, injured due to Wenbing suffering, with still remaining of Wei Qi representing and poorly distributed geographic tongue coatings here, and still greasy white, but a lot of patches has lost the tongue coating. So a lot of what dehydration shows from previous heat suffering damage the yin. So this is typical qi deficiency, also yin very bad damage. This yin damage especially, can you see huge dent around here? Looks a little bit spoon. Can you see this? Huge dent here. Anybody see this? Huge dent like little spoon. Yes? So upper jaw, lung, heart has a very serious deficiency from previous sufferings. So this patient need a lot of care to tonify the qi and the yin and clear some possible remaining of the congestion heat. So this is more severe stage of heat for the image 3, severe stage. This could be latent pathogens, but this is later stage suffering with severe yin and qi deficiency. There's a question, could that be as a result of mental health issues? Yes, could be mental health issues due to taking some medication, because I tried to collecting a tongue diagnosis with Wenbing we discussed for the first 4 weeks and today, yes. Some medications used for mental disorder, especially schizophrenic, can cause a lot of troubles with the digestion systems. Therefore, the tongue coating distribution can be changed, and all the other tongue color also can be changed as well. And that's all for today. Thank you very much. And if there's no more questions, I will see you next